I want to be a healthcare worker who can talk about healthcare. Kylie the Krankenschwester. I know it doesn't roll off your tongue like a porn star name, but I love it. There are three things you need to acknowledge. One, your own mortality. Two, the fragility of health, yours and everyone else's. And three, the equality of life. Hi, I'm Kylie the Krankenschwester. I am a nurse. I am a part of Punks for Progress, and I'd really like to thank them for giving me the courage to be mad. I work in a healthcare system. I work in the healthcare system in America, and I'm so frustrated with it. And on a daily basis, I see patients mistreated by systemic flaws that are accepted as normal. And so I hope to make a series of videos, short videos, to get out my frustrations. I have so much flying around in my head in things I see, things I think, things I observe, things I hear from management that are just upsetting. And I'm hoping to find a community or create one if it doesn't exist of healthcare workers or even people who've interacted with the healthcare system who want change, who are not afraid to talk about how this is unacceptable, the way things are going. The healthcare system we presently have in America is the product of a 100-year history of lots of social and political and historically significant events. I love social science as much as physical science, and this is why nursing works for me. Um, but I have dug into the last 100 years and found the significant legislation of the past 100 years that has led us to the system we have today. And I think it's really important to share and to have people everywhere understand that the healthcare system we have today can change. One of my favorite creeds is that once you realize things haven't always been this way, you start to imagine how things could be, right? If things haven't always been this way, that means they don't always have to be this way. And it can give people a lot of courage and power. And our power as people comes in solidarity. And a way to get to solidarity is sharing our stories and finding common ground. So I hope to create a community, create an atmosphere, a space for people, for healthcare workers or patients or anybody who has had poor experiences with the healthcare system to be able to not just complain. I mean, you can complain, just complain, that's fine. But let's go one step further and trace it back to who was in power at the time when that legislation passed. That now, 50 or 70 or 100 years later, now dictates your outcomes with not just your healthcare, your life. So I like nursing because it's a balance, and it's not a perfect balance. It's always a shifting balance between social science and physical science. Yes, there's been lots of research, and doctors are well aware of how to treat a heart attack or how to treat diabetes. But then, as a nurse, like I get to know the patient, and I know the obstacles they have to either one, just understanding the diagnosis, two, affording the medication, three, having higher priorities in their life than their health. And so navigating how to best help patients, I so enjoy. I have to say that patients and families always appreciate not only when I can translate doctor jargon into layman's terms about their diagnosis, um, I can also talk about our healthcare system from an outside perspective. I am not a drone of the healthcare system. I feel like it, but I feel like I'm working against a bigger system that does not care about the overall well-being of patients, but rather statistics and profits. And that's what a healthcare system within a capitalistic society does. I biggest frustrations about nursing is as a profession, we're taught in school and by management every day at staff meetings that we are patient advocates and we have to, think ahead for patients and we're educating them and think of what's best for the patient and what if that was your mother sitting there. But then as soon as you go up one tier in management and then higher, that is not the goal of the healthcare system. It is about numbers and profit. And I feel like I'm swimming upstream. I feel like I'm always working against a current for my patients, and it's really frustrating. So that is one of the reasons why my motivations behind these videos to express and get out my frustration, and then hopefully find a community that feels the same way. Then find solid ground where we can start to talk about healthcare as a concept, as a construct, as a system, and then how do we go from there? How do we change what we already have? I'm really excited for this series of videos. I want you to know that any patient information I share has been put through a HIPAA filter, right? Our Health Information Privacy Protection Act of the 90s or 80s, whenever that was, that health information is protected. Your name, your birth date, your diagnosis, and any identifiable information. I'm not sharing personal information of my patients. And also, I'm going to try not to diss on specific hospitals and healthcare systems at this point. And that's because I still need a job. um, Anything I bring up about healthcare or certain hospitals or healthcare systems is going to be public knowledge based on, public news sites and stuff. However, understand I have inside information about what goes on behind closed doors because I've worked inside the hospitals and I've been in on staff meetings. I've been in on their little town halls. I see their posters in the staff bathrooms, right? Like I know what's going on the inside. I can contribute to this conversation. I also hope to articulate a lot of my frustrations so that when I'm dead and gone, the world will know what Kylie the Krankenschwester had to say about healthcare and my parting advice.